Hi, Jamie Davis from the Nursing Show here at ANIA 2016 in San Francisco. We're talking to a bunch of the attendees about things. I have Gerry Franklin here, another one of our nurse attendees, talking about everything informatics and healthcare IT. And there's a lot of things we're going to be talking about with Gerry, but one of the things I want to do first is, Gerry, tell us a little bit about your journey as a nurse. Why did you want to become a nurse?
Well, so I actually didn't. I actually wanted to become a doctor, but I'm from a poor family. I didn't have the funds, and I got a scholarship to a 2-year nursing program. So I graduated from the 2-year nursing program thinking I would then go on, and I just fell in love with nursing. And I stayed with nursing because I loved it so much, and ended up being a nurse for 36 years. I'm very old. I died of the grave.
Can't tell. It's all good.
So I loved it that much.
Yeah, and so what drew you to the technology side of nursing and healthcare?
So technology happened for me. I was actually on a management track about 8-9 years ago, and they chose the unit that I was manager of to pilot the first med reconciliation that the hospital I was working at the time was going to do. And so I felt it was really important as the leader in that department to learn the program myself and to educate my staff and to work with them as a super user so that when we did go live that we would be successful and that they would have somebody that they could lean on. And we were very successful, 100% compliance for 3 months. And so when they decided to take it house-wide, they had just opened up a nursing informatics department, and they asked me to help educate the entire facility, all the units. And from there, when they brought in the EMR, they asked me to join their team. Big decision, but I ended up changing my path from management to informatics, and I have loved it. I've been doing it for 8.5, almost 9 years, and I absolutely love it. It was a great choice for me.
So I've been talking about a lot of different topics here, among them usability, and you and I were talking before we started recording about that usability is important because we need that re-education, that refresher training. And nurses do this all the time, but it's usually focused on the patient care, on new research about best practices in the medical care, the actual physical health care of the patient. But that needs to be technology focused as well.
It does, because as new best practices come to the forefront, it actually has to be incorporated into the documentation. And with that, it really requires the nurse to get that re-education when workflow changes and we have to change things. And a lot of times when you first initially educate them, whether they're a new orientee or you're implementing a new system, they don't retain 100% of what you teach, you know, and so putting them out there, letting them become familiar with the program, and then having that opportunity to bring them back in and rework through the workflow or reevaluate the workflow and help them to prevent those workarounds. I just think it's so important, and it's a hard thing to do because you have to really pull them off of their unit, out of that environment, so that they can sit back and really reabsorb the right way to do things. So it's a challenge, but I do think it's really important. So reaching out and educating to informatics, changes in workflow, new best practices that come out, patient safety issues, it's just very, very important.
Yeah, there's so much that's expanded in our general scope of practice as a bedside nurse or even in a specialized situation, and so much technology just keeps getting added. As new things come along, it seems like it's just snowballing.
It's a quick snowball, and in fact, part of this education can be incorporated into mandatory competencies annually that can really benefit the end user, the clinical end user at the bedside, because it's a challenge. You want them to take care of the patient, but you also want them to accurately document so that what goes in is what comes out. Old saying, but it's very, very true. And so all the reports, the measurable reports that have to go out, and the quality measures and the QRI and all of that, it's really relevant to be able to pull good data that you can use to make decisions, to report, to all of that. So I just feel that re-education is so important. But it goes back to the usability, and it goes back to, and being able to reevaluate the workflow and improve workflow as an informaticist to fix the issues, to improve that workflow for the end user. So that's all.
So So you're here at the conference. Last question. Why is it so important for nurses to come and become actively involved in their professional organizations, whether they're in critical care and informatics, whatever the case may be, and attend their specialty conference like the ANIA conference?
So several reasons, but one is the biggest is to stay up on top of current things that are happening. Sometimes you get so lost in your organization and what you're doing and your daily work that it just helps you to keep up, keep networking, connections. That networking is so important because then you can walk away and wow, I met somebody who's using the same system and has the same challenges. And then again, just to keep yourself updated on all the new technology, the new EMRs, the new interfaces. I'm here, smart pump interfacing. Looking forward to that. So, yeah.
Well, Gerry, thanks so much for coming on the Nursing Show. And I want to thank all of you for checking out this segment here. We're at ANIA 2016 in San Francisco, and I want to urge you all to check out all of the videos. They're going to be over at ania.org and also coming out subsequently over at nursingshow.com in our regular show feed. So check out all of the interviews that we're going to be shooting here. It's going to be a bunch of them, and you can really become more aware of what's going on in your healthcare technology and the things that you use every day to take care of your patients.